How does cognitive decline progress with Alzheimer's disease? Imagine watching a once vibrant mind gradually change, like a fading photograph. Alzheimer's disease causes a slow but steady decline in how the brain works, affecting memory, thinking, language, and daily skills. The process unfolds in stages, starting with mild issues and eventually leading to severe dementia. In the early stage, people might notice small memory slips, especially with recent events or conversations. They might forget familiar words, misplace keys or glasses, or struggle to plan simple tasks. Despite these signs, they often still manage daily activities like cooking, driving, or working. Family members might see these changes first, and doctors can detect mild cognitive impairment, which is an early sign of Alzheimer's. As the disease moves into the middle stage, the decline becomes more obvious. Memory problems deepen, and individuals may forget personal details or struggle to recognize loved ones. Speech can become confused or rambling, and they might get lost even in familiar places. Mood swings, depression, agitation, or even delusions can appear. Motor skills also decline, making tasks like writing or using objects harder. At this point, they usually need more help with daily routines, like dressing or preparing meals. In the late stage, cognitive functions are severely impaired. People may no longer recognize close family members or understand their surroundings. Communication can be minimal or absent, and they become entirely dependent on caregivers for all needs, including eating and hygiene. Physical health also deteriorates, often leading to immobility and increased risk of infections. Sleep disturbances and incontinence are common in this stage. The entire process from early signs to severe dementia usually takes about 8 to 12 years, but it can vary widely among individuals. Over time, the brain's ability to recall words, recognize objects, or solve problems diminishes. Early on, verbal memory issues are most noticeable, but as the disease progresses, visuospatial skills, problem solving, and language abilities decline. In the final stages, even basic functions like recognizing loved ones or speaking clearly become impossible. Before symptoms appear, some people may have what is called preclinical Alzheimer's, where brain changes happen but no noticeable problems occur. Mild cognitive impairment is a step further, where memory or thinking issues are noticeable but do not yet interfere with daily life. Not everyone with mild cognitive impairment will develop Alzheimer's, but those with specific brain changes linked to Alzheimer's are at higher risk. Understanding how Alzheimer's progresses helps families and healthcare providers plan for the future. Early diagnosis allows for better management of symptoms and support, which can improve quality of life. The disease is linked to the buildup of abnormal proteins called amyloid plaques and tau tangles in the brain, leading to the loss of nerve cells and brain shrinking. In summary, cognitive decline in Alzheimer's begins with subtle memory and language problems, gradually worsens to affect multiple brain functions, and eventually results in full dependence on others. Recognizing these stages can help ensure appropriate care and support are provided at each step. Always consult healthcare professionals for personalized advice, as each person's experience with Alzheimer's can be different.